Which diabetes drugs should you be avoiding? Are there certain diabetes drugs which are better than others? Are there certain drugs which are preferential and should be used before other types? There are. And in this video, I'll be going through it with you. It is important to note, however, that this video is intended for clients with type 2 diabetes, particularly those who have an increased waist circumference, and would be more relevant for those clients who've been diabetic for a shorter period of time, ideally under 5 years. The information on this video may not be relevant for people falling outside those groups, and even otherwise, you should not take information from social media on face value. Make sure you run it past your own physician and primary care provider to put it into context of your own individual situation. I'm Dr. Rawat, an Indian origin, England-trained, Canada-based physician who additionally studied nutrition at Harvard and founded healthgroupcoaching.com, where for several years I've been running a metabolic disease reversal program. To really understand which the best drugs are for type 2 diabetes, we need to understand what the causes are behind type 2 diabetes. Remember, type 2 diabetes is characterized by something called insulin resistance. If you were to measure insulin levels in a type 2 diabetic, particularly early on in the first 5 to 8 years, and also in pre-diabetics and those with insulin resistance, the amount of insulin in the bloodstream would be higher. This is because type 2 diabetes, despite sharing a name with type 1 diabetes, is almost the opposite. While type 1 diabetes is characterized by insulin deficiency because it's an autoimmune condition which leads to the destruction of pancreatic beta cells which produce insulin, that's not the case with type 2 diabetes. In fact, the problem here is resistance to insulin, which means that the levels of insulin are actually higher in these clients. If you understand what the underlying factors are which determine insulin resistance, then we can understand which drugs for diabetes are better for the underlying condition and which drugs are less good for the underlying condition. So which drugs would promote a remission or reversal of the condition, and which drugs may bring sugar levels down but will in the longer term not actually make the condition go away. If anything, in the background, the condition is getting worse. So let's first understand what the background problem is here. Here we have a faucet, and the energy coming in, calories, energy, sugar, goes into this sink, which contains your blood sugar levels, and it contains a drain, which is your calories coming out. Now, if you have a chronic overconsumption of calories or energy or sugar, then there is a danger that your sink will overflow. And in your body, you have an organ called your pancreas, which produces a hormone called insulin, and they have been tasked by not allowing that sink to overflow. They've been told that increased sugar levels in the bloodstream can damage your eyes, your nerves, your private parts, your kidneys, should not be allowed under any circumstances. And so insulin gang comes out and shuttles that extra sugar, if you're active, into the engine room, which is your muscles, or it can shuttle it into your muscle stores, which is glycogen, which is like your store of energy right next to the engine room. It can also convert this into fat to be stored under your skin. It's called subcutaneous fat. That's like storing in your garage. Unfortunately, some people have a double garage or even a triple garage. Other people don't even have a garage or a very small garage. And so because of ancestral genetic factors, people have a different personal fat threshold. For example, those people whose ancestors lived in warm tropical climates, they didn't need a lot of fat under their skin for insulation, so they don't have a lot of storage of fat under the skin. In fact, they needed less fat because they needed their skin to be cooled, while those people whose ancestors lived in colder climates have a larger personal fat threshold. And this is why people from South Asian, Southeast Asian backgrounds can develop type 2 diabetes at a much lower BMI as compared to white Caucasians. from Northern Europe, for example. But once these three options have been exhausted, insulin gang then has to start putting sugar and energy in the form of triglycerides and fat away into places where it's not safe to do so. For example, around your belly, in your liver. This is how this causes damage to the liver. We call it lipotoxicity or fat toxicity. It causes inflammation. And to defend against this, the liver then starts producing its own gang, the insulin resistance gang. It's like a bouncer at a nightclub trying to stop insulin gang from pushing more triglycerides and fat energy into the liver, saying that there's already too much fat in the liver. And by definition, if you have more than 5% of the liver taken up by fat, that's called fatty liver. And so this fight ensues between the insulin gang and the insulin resistance gang. The pancreas starts producing more and more insulin, but eventually there's only so much that pancreas can do, and it starts failing. It can't produce enough insulin and the sugar levels go up. The client starts becoming pre-diabetic, diabetic, and so forth. In the background, there are also other metabolic factors like your gut microbiome, which have an effect on this whole process. So if you look at where these medicines will have an impact, you can see whether they're beneficial or not. Those medicines which are having an impact more on this top left corner, calories in, calories out, gut microbiome, and liver, can potentially have a beneficial impact on the condition. While those which simply increase insulin are promoting the insulin gang and will lead to a temporary reduction in blood sugar levels, but the underlying condition will not be affected. So how can you reduce calories? You can go into a calorific deficit, you can eat cleaner, you can do intermittent fasting, and you can also take certain drugs. For example, Ozempic is a GLP-1 agonist, which is a powerful appetite suppressant, so that will help with reducing your calorie intake. Other drugs we call DPP-4 inhibitors, which slow down the degradation of your own natural GLP-1. These are drugs like sitagliptin, Januvia, linagliptin, Tradjenta. They're milder than Ozempic, but also will have an impact at that level. So these are beneficial drugs. Medication like acarbose, which reduces the absorption of sugar, also works at this level, although because of its side effect of flatulence, it has mostly gone out of favor. Medication like empagliflozin Jardiance, canagliflozin Invokana, dapagliflozin make you pee out more sugar, and so that will increase the calories out by making you pee out energy. They will also promote weight loss and are also beneficial. Medications like metformin are primarily sensitizers of insulin, which means they make your cells more sensitive to insulin, but it also has a mild appetite suppressing effect and also has an effect on the gut microbiome, and so is also beneficial. Even certain supplements which would reduce liver fat like omega-3, improve the diversity of gut microbiome like fiber and probiotics, and would increase your anabolic response to resistance training like protein, creatine, omega-3, vitamin D, and multivitamins. All of these will also have a net positive effect on your type 2 diabetes. The particular medications like insulin and drugs like gliclazide and glimepiride, which we call sulfonylureas, which make the pancreas produce more insulin, will have an effect of reducing your sugar levels, but don't positively affect your type 2 diabetes in the long term. In addition, there is increased risk of hypo attacks or low sugar attacks with these drugs and weight gain as well. If you'd like to join me on my 4-way coaching program to reverse metabolic disease, then visit me on healthgroupcoaching.com. The program consists of 8 Zoom group coaching classes as well as tracking on the program, and this also includes direct messaging with me on the app. I hope you found the video useful. Do share it with any friends or family who will benefit from this information. Remember to like the video, share it, subscribe to the channel. If you'd like to watch some more videos, then click on the links to watch those, and I'll see you at the next video.